We know that substance abuse impacts children and families and costs everyone in our community. We also know a strong family unit and mentoring relationships helps in preventing and treating methamphetamine use. But what is mentoring? Who can be a mentor? Does mentoring really help our youth? Let's join our 2-year health film crew on location and find out from an expert.
The Kern County Methamphetamine Task Force is a collaboration of law enforcement, faith-based community organizations coming together to reduce the use of methamphetamine in Kern County. The focus of the Family Wellness Support Committee is that we understand that of youth aged 15 years and younger that begin using drugs, they're 4 times more likely to become addicted. So what this subcommittee does is makes parenting classes more accessible to parents so that they can better parent their children to be drug and alcohol free. It makes parenting classes more accessible, yes, parenting classes, so that they can teach kids the advantages and disadvantages of using drugs and alcohol and what a strong family support system looks like. Methamphetamine use usually begins in teenage years. Of the adult methamphetamine users, 80% of them report using methamphetamine at the age 15 or younger. Typically, underage drinking is the beginning of their drug career.
And why is that?
It's easily accessible. It's legal for those that are of age, but they usually get it from older friends, and unfortunately, in some cases, they can even purchase it themselves. It totally destroys the family. It just shakes the very foundation of a family. It destroys what our communities and what our nation is built upon, which is strong family relationships. Health problems, legal problems, financial problems, really devastates the entire family. I like to keep it real simple. Stop, look, and listen. A lot of times in life we get so busy that we don't stop and we're not aware of what's going on in our very homes. So the first thing we need to do as parents is just to stop, slow down, assess what's going on in our home. Stop, look at our children. Are they doing things different? Are they hanging out with different people? Are they going different places? Are there changes in their grades, changes in things that used to occupy their time, now they're not interested in? If we're aware of what our kids are doing and listen to what they have to say, then we can prevent them from using drugs and alcohol. Being aware is the biggest one, but also helping control the environment that our kids are in. Being aware also of what they're doing in regards to computer access and some of their friends. First thing they need to do is have a conversation with their child. Not at the exact moment, but when the emotion is cleared, have a conversation, not a confrontation, with their child. Then they need to seek some professional advice. Get the child screened, assessed, and if treatment is necessary, get them involved in treatment. Mentoring is very important in preventing the use of methamphetamine. Mentoring provides positive role models for individuals that may not have that at home. There are various organizations within the community that provide mentoring services to school-age youth. There'll be a conference on April 6th at Cal State Bakersfield for anybody that's interested in becoming a mentor. The most rewarding part of my job has been when a student comes to me and reports that they're drug and alcohol free and that they're doing good in school. What I would like to see changed is I would like to see more emphasis placed on prevention and treatment. We're spending a lot of money, governmental agencies are spending a lot of money in incarceration. My personal opinion is that incarceration is not the answer. Rehabilitation, treatment, and prevention is what the answer is. Kids this age, 10, 12 years old that are using methamphetamine, that's where we need to put the dollars to prevent that type of usage. I'm involved because I have a personal history, and it has become my life mission based off of my personal history, so it's my way of giving back to the community. I would just encourage parents once again to be aware of what's going on in their homes, in the lives of their children. Just slow down, be aware, and then respond accordingly. If people want more information, they can go to the website, which is kernstopmethnow.com, and they can find information there on both prevention and treatment.